All right, I think we can start. Hello, everyone. My name is Anna Burляeva, and I'm part of disability team in New York headquarters. Welcome. Today we're discussing one of the most important topic that, as we recently saw throughout the GDS Summit, the 24 hours event, really was on in every session. It's a stigma, discrimination, and ableism against persons with disabilities. I'm going now to briefly explain you some housekeeping rules for today. This webinar is being recorded. There is international sign interpretation and the real-time captions. You will see it on your screen in English, and we will also going to post the link for other languages, automated translation in Arabic, French, Spanish, Chinese, and Russian. Kindly take a few seconds to enable the languages for your choice. There is an option also to mute the audio. Please don't use this button. Should you have questions for panelists, kindly use the chat function. Our team monitoring the question carefully and will respond to us as soon as we can. We hope you'll have time for questions where participants may want to ask questions. It will be at the end of the session. However, the chat might be limited, so we also welcome you to send the message in the chat. Should you have any technical issues with accessibility, please send a message to the host and we'll solve them as soon as possible. We're kindly asking all speakers, all guests to turn off their video so we can ensure we have a right bandwidth. And please, everyone, speak slowly and stick to time so our interpreters and our captioner will have enough time to follow. Now we are opening the discussion with a message from Rosangela Berman-Biller, Global Disability Advisor from UNICEF. Next message will be with Shirley Liu from Australia. She is a young disability advocate. Let's begin. Okay, everybody can see the screen. Give me the sign. Okay, thank you.
A warm hello from UNICEF to all participants. I welcome you to this session today, which topic should cut across all efforts towards achieving disability inclusion. We will think together about how to address attitudinal barriers, promote equality, and empower communities. We are proposing this session to be a co-creating workshop to reflect on one of the key approaches to social and behavior change, which is community engagement. We can only combat stigma and discrimination if persons with disabilities are the decision makers, the guiding and leading force behind any strategy to be taken. There is no more need to talk about the reasons why we must combat stigma and discrimination towards persons with disabilities. The reasons are reflected in the lives of the most of the 240 million children and adolescents with disabilities of the world who are still left behind, living in the margins of society. Now it is time for discussing solutions and acting upon how we will address stigma, discrimination, and ableism in an effective and sustainable manner. We know from research and evidence that most children with disabilities experience multiple and intersectional forms of discrimination, which generates patterns of social exclusion and vulnerability. This is particularly the case of young women with disabilities and youth from poor economic backgrounds, indigenous, LGBTQI+, those who belong to ethnic minorities, from migrants communities or other marginalized groups. UNICEF has long-term recognition for its expertise and leadership in the area of social and behavior change communication that we also call SBCC. And in our 2022-2025 strategic plan, for the first time, we have an indicator to measure UNICEF's results towards eliminating stigma and discrimination against children with disabilities. Recently, UNICEF has collected evidence on effective and ineffective approaches to address stigma and discrimination against persons with disabilities and other excluded groups, and has developed tools to measure attitudes and norms around children with disabilities. Thanks to the generosity and support of the government of Norway, we are currently advancing this work, and after extensive research and consultation in 2021, UNICEF partnered with Think Place and Light for the World to develop a global resource pack to address stigma and discrimination towards persons with disabilities. I welcome all of you to take part in this co-creation process today, and I call for all the partners, governments, UN agencies, and organizations of persons with disabilities to work for disability inclusion and to engage in this process. Stigma, discrimination, and ableism are the root cause of exclusion and must be eliminated from society. Have a good time with us today. Thank you.
Thank you. And now we show a quick video from a young disability advocate from Australia, Sheridan. Just a second. And sorry, we have some technical problems. The video is loading a little bit slower. Carly, why won't you start? And maybe after your introduction, we will show the video, if that's okay.
Yeah, sure. So my colleague Nafisa and I will be leading this session. So hello, everyone. It's such a pleasure to be here. My name's Carly James. I'm the Executive Director of Global Development at Think Place. Think Place is a design and innovation firm, so we're not often in these circles, and it's such a pleasure to be here. We really specialize in SBC, social and behavior change, and that's really the focus of this toolkit and what we want to talk to you about today. We're working in really close partnership with my friend Nafisa Babu. So Nafisa, over to you.
Hi, Carly, and really welcome to your first Global Disability Summit. It's really great to be working with you. So my name is Nafisa Babu, and I'm the Director on Inclusive Education for Light for the World. And we are a disability and development organization. And combating stigma and discrimination against children is really central to our work and in all spheres of work, because this is really what we get to talk about, a solution like Rose Angeles mentioned. And I'm really happy to be working with an expert organization like Think Place that works in SBC. And it's really important that we collaborate to come up with really fresh and new ideas, because this is what it's all about if we want to take things further in our sector. So, at Carly, and you probably know that lots of organizations like ours have been working on issues around stigma and discrimination, partly because we know it's such a big problem. A recent UNICEF report mentioned that children with disabilities, in comparison to their counterparts without disabilities, basically are less likely to receive early stimulation and responsive caregiving, and 41% more likely to feel discriminated against, right?
Yeah, these are major complex issues, and I feel like the urgency is there. It's just unacceptable, isn't it?
Yeah, it is. And I think all of our organizations work in disability and organizations of persons with disability. We do a lot of awareness raising and advocacy to help change attitudes and push for change. Usually do these things at a high level, right, to change policies or create guidelines, or we are doing things more on a standalone individual level with families and children. But we know it's very hard for us to know, we're not sure about what is effective, if it is effective, how to measure if things have changed, and which approaches are really having a lasting impact. So these are things that we don't really know about so well. And I guess that's what ThinkPlace can help us with, right, in SBC.
Yeah, I think that's where SBC comes in, definitely helps us kind of bring some of those things to the surface and really kind of tease some of that out.
Can you tell us, maybe it will be useful for colleagues here to tell us about maybe what is the difference between SBC and things like awareness raising and campaigns, because that might be helpful for us to understand.
Yeah, and I think it's good framing for the toolkit. So SBC refers to social behavior change, of course, which is any range of interventions which targets those deep underlying drivers of human behavior. So if you think about our day-to-day lives, about 95% of our decisions and our behavior, our actions is completely unconscious, subconscious, right? So we are driven to do things for any multitude of reasons, and it's hard sometimes to articulate why it is that we do things, in an authentic way, which is why really traditional forms of research and traditional forms of problem solving it usually don't work, right? We're sort of asking people to explain why they do something, which may be kind of second nature or unconscious. So for any of these kinds of behavioral or cultural questions, we generally try to approach them knowing two things. So the first thing we try to keep in mind is that awareness raising alone will not work. It doesn't work. We know that the evidence is there, because an increase in knowledge doesn't always mean an increase in comprehension and appreciation for something. So people really have to be inherently motivated to act differently. And it takes a repeated intervention to reinforce and affirm that behavior in order for something to work over time and for that behavior to really stick. So that's one thing. And another thing we try to keep in mind when we do SBC work is that, like I said, it's this kind of longer time scale that we're operating on. So behaviors and sort of behaviors writ large, i.e. norms, they don't change overnight. It's no singular intervention that's going to work. So as this toolkit speaks to, the interventions really need to sort of be multiplicitous and multifaceted. And that really is ultimately what drives a sustained behavior change.
I can imagine that in our sector, it is quite a difficult task to take on, because, the stigma and discrimination that children with disabilities and families and youth experience really is deep rooted, right? And deep seated in this ableist kind of thinking where people think that, you have to have certain standards of functioning and appearance and behavior to really live a life of value. And it's really a common thinking that leads people thinking you need to be fixed to be fit for life in society or school. And I can imagine that, it's so deep-seated that it takes a lot of time and a multifaceted approach to tackle. So I like this, that we need the approach is tackling stigma and discrimination more in a holistic and integrated way. It's multifaceted, multi-level, and combines multiple audiences. So I think, I get it. So I see how this SBC approach could potentially be a better way, a game changer for us in the sector. So I was just wondering if you can maybe tell us about some of the SBC work in other sectors that we can draw from or learn from.
Yeah, there's a few things that come to mind. So ThinkPlace has worked on a number of different SBC projects, of course, in a variety of different sectors, as you say, and really trying to take an integrated approach. That's extremely important, as you said. And tackling stigma and discrimination is something that we see as this massive problem in each of those sectors. So one thing that comes to mind is a recent example from sexual and reproductive health, where we were really trying to tackle stigma and discrimination and the way those things manifest among adolescents who are seeking essential health services, things like maybe post-abortion care or modern contraception in times of an emergency or something like this. So in that case, they face a whole multitude of barriers, but we don't really like to think of barriers per se. We like to think of what's actually motivating someone's behavior, even if that behavior is undesirable. So in our case, we did a whole host of research into service provider behavior. It's not something, like I said before, that you can sort of sit down with a clipboard and ask in a survey or in an interview. It's really something that has to be observed. We don't always say what we do, and we don't always act out what we say that we do. All of our behavior is so context specific and situational. So anyway, we sort of got underneath that in this case and ended up designing a suite of interventions that really targeted the various motivators of service provider behavior and tried to flip kind of their attitudes and their beliefs and ultimately their actions. So again, really kind of a multifaceted approach from that person's journey, the adolescent's journey from their home all the way to the health center and back, and how they interacted with their social services and shared that experience at the health center after. So we try to look at the big picture and really think about all of the different touch points that we can have.
Yeah, I really like that. It's about really going deep and also, like you said, hearing more about the experience of a child, a youth, or someone who's experienced it and bring those kind of facets together with the service provider and the service user. I was thinking, Carly, maybe it would be great if you can tell some of our colleagues here what our plan is, what we're aiming to create together, and hopefully harvest some of their knowledge and skills and create a collaborative co-creation process.
Yeah, sure. So by way of introduction, Nafisa and I wanted to have a bit of a conversation together about this to really frame up, why are we talking about stigma and discrimination? Why are we talking about SBC? And how are we linking that to, you know, the lives of children with disability and what they face in their everyday experiences? So in this session, we're going to be speaking about a toolkit that we're working on together. And we're really aiming to co-create this toolkit with UNICEF, with OPDs, with sector experts. So SBC practitioners, development practitioners, subject matter experts in disability inclusion, and youth advocates, who have tools and resources and a host of inspiration to share that can really help us combat stigma and discrimination and ultimately promote meaningful inclusion of children, youth, and their families. So the tools and approaches that we are hoping to include in this toolkit, it's really important that they are evidence-based. That's a massive gap that has been identified in the field. That they're highly practical. Of course, this is a toolkit. This is not a manual or, you know, a compendium. This is a toolkit. It has to be practical and it has to be user-friendly. So a cornerstone of the way that Light for the World and Think Place are approaching this is that it really needs to be user-centered. So we're thinking about the multitude of audiences who will ultimately engage with the toolkit and trying to design for the extremes and everyone who sits in the middle as well. So that is the goal of today. I think we wanted to loop back before we get into the slides and the presentation we have, loop back to the video that Anna had, which was from the youth advocate. Thanks, Sam, to frame up. So Anna, back to you.
Global Disability Summit Youth. We asked youth with disabilities around the world to talk about stigma and discrimination. Shirley Liu, Australia. All around the world, no matter where you live, there exists youth with varying disabilities. These include individuals who are deaf, hard of hearing, deaf-blind, blind, have physical disabilities, are amputees, or have intellectual disabilities. Irrespective of their diversity, what they all have in common is striking. Every day, they face barriers in their lives because they are labeled as disabled and therefore experience discrimination by the wider society. We shouldn't be, and we don't deserve to be stigmatized. We are all human and should be seen in the same way as non-disabled people. We should be treated equally. Unfortunately, labels increase the likelihood and incidence of being discriminated against. If we weren't stereotyped so much, there would be less discrimination. Discrimination is powerful and detrimental. To give an example, the deaf community is often viewed from a medical lens. Deafness is perceived as something to be fixed, with cochlear implants being seen as essential and a cure for deafness. Alternatively, deaf people see ourselves as part of a cultural group with a unique language and a rich heritage to be passed on from generation to generation. That's powerful. We don't want to be labeled in a negative way by the medical profession. The label that we choose for ourselves is being part of a unique culture and a world that is accessible. Imagine a world without labels and discrimination, an inclusive society irrespective of where you are. What would an inclusive society look like? Imagine a world where the philosophy, nothing about us without us, was ambiguous. Accessibility would be inherent. An interpreter could be provided via the use of an avatar or a hologram. Spoken language would be automatically translated into captions. Imagine never having to ask for either interpreters or captions to be provided. Technology would be developed with deaf friendliness in mind, easy for deaf people to use, with thoughts able to be translated into spoken format. Quality language services will be provided for families with deaf babies without question with the result, language rights, and ideal language and life development. Equitable access to education and the workplace will be provided as a matter of course. If this was all provided, there would be no need for labeling or discrimination to occur. Imagine not needing to have to advocate constantly with the government or to lobby for laws to change to accommodate us. Everything would be much more streamlined and the world would be a very different place.
Presented by International Disability Alliance, Atlas Alliance, Youth Mental Health Norway, UNICEF.
All right, wonderful. So I think we'll just get into the slides now. Thank you, Sam. Great. So the first thing we wanted to share is the following slide, which really speaks to why are we all here? Why are we doing this? Why should this toolkit exist? So just the next slide, please. So the motivation for the toolkit, which I always think it's the simplest questions, which can be the hardest, right? But it's always important for us to remind ourselves why we're all here and why we're creating this. So really we felt like there was a lack of a central knowledge base for those engaged in C4D work or SBC work, communication for development or social and behavior change, or communication for social and behavior change work that addresses stigma and discrimination experienced by children with disabilities. So we imagine, a large portion of the users of this toolkit will be SBC practitioners who may sort of work across these different spaces, but who really don't have a go-to singular resource that addresses stigma and discrimination against children with disabilities. So that's really kind of the key. And UNICEF has done a whole host of research and an evidence review to support this gap. The toolkit focuses really, as I mentioned in the opening, that we're seeking to provide insights and tools and resources and really, really practical support to help ultimately optimize SBC programming and to make sure that children with disabilities and their families and their communities are included, that they're empowered, that they're engaged appropriately and meaningfully, and that they're able to live inclusive lives with equal opportunities as their peers. So what are we seeking to achieve with the toolkit? First, we really are hoping to structure the toolkit using a twin track approach. So of course, we want to balance the very general interventions with ones that are more targeted and specific. And then, of course, we want to address stigma and discrimination at different levels of the socioecological model. I'm sure many of you are familiar with that model, but sort of across all levels of someone's human experience. So sort of at the individual level, community, family, household, policy, environment, that sort of thing. So we are really seeking to have a toolkit that is holistic in its approach and is integrated as well. So it's not sort of relying on more traditional silos. Again, sort of bringing together a lot of what already exists. There's not a lot that we're creating from scratch. A lot of this already exists in your work, in your heads, and we're trying to sort of get that out and sort of get that into one place. So that's sort of the framing, and I'll pass to Nafisa, I think, to introduce you to the modules.
Thanks, Carly. So the modules that will be looking at, there are 7 modules. The first one is looking at understanding stigma and barriers to inclusion, and really unpacking those. What is ableism? How does it manifest? And also bringing in some of the voices of young people and service providers. So getting a more of a holistic understanding around the theory. The second one will look at participatory research, because I think we also know that every context is unique. And so it's important to hear from families, children, and youth with disabilities, and get a good understanding of what the situation is. So that participatory research where people with disabilities are involved is really important. The second module will look at empowering children with disabilities and youth with disabilities and their families. The third module is understanding and engaging communities. And this is really essential that we do this in a deliberate way. Then on the fourth module, we'll look at disability inclusion and sensitive services. That means in education, in health, and then among other. And the fifth one is looking at strengthening partnerships for advocacy and mobilization, because this also really helps to create change on that top level that Carly spoke around, policies and etc. And then the sixth one is on monitoring, evaluation, and measuring, because we want to see what effect has our intervention had over time. And I think this is really important to know its effect and to track change. And then lastly, we look at integrating strategies across the whole SBC, social behavioral change space. So what we're asking for, and I think what we'd like from this workshop and subsequent workshops that Carly will talk about, is to really gather learnings from you, best practices, practical tools that you and techniques that you've gathered over time and in addressing stigma and discrimination. So this is our goal. And I know that Sam will put in the chat there a link where that could be used for you to log onto, and your interest in participating in this co-design process. So over to you, Carly, and you can explain a bit more about how we will formally get people engaged in our co-creation.
Thanks, Nafisa. Yeah, I'm just going to ask maybe Sarah, because Sam is managing the slides. Sarah, if you can share that link. It's a call, as Nafisa said, for resources. We are very open to anything you have to share with us that's relevant and we know works. Great. So just to move us along in the slides. Sam, next slide, please. Oh, thanks. So we wanted to zoom in on one of the modules to give you a flavor of what you can expect if you were to pick up this toolkit. We have structured the content according to 4 kind of big chunks of information, let's say. This is kind of our logic for each module. So the 4 chunks of information are ready, which is laying the theoretical foundation. So this is really a chance for us to introduce the topic of the module and make sure that you understand sort of, the theory that underpins this module. Steady is the next piece, which is understanding how it works. If you think about kind of a recipe, this is the how-to, this is the actual the guts. This is really how it all works. Set is gathering inspiration, so kind of preparing and staging your work for getting into all of this, I suppose. So this is where you can read about best practices, you can hear testimonials, you can engage with case studies and success stories. That's that piece is sort of how others have put it into practice and what works well. And then go is really just this, the really practical piece around the tools and the resources that actually help you put it all into action. So we wanted to spotlight module 4, which, as Nafisa said, is our disability inclusive and sensitive services module. This is taking an SBC approach and an integrated approach to how we might go about designing and developing these kinds of services. So in the ready portion, which, as I said, is the theoretical foundation, we would cover things like the most common barriers to inclusive services and why these things are invisible, meaning, they're not easy for us to find and they're not easy for someone to articulate, so how do we sort of use research and other kind of creative tools and methods to get around that. Reducing stigma through SBC interventions that target service providers. So learning about how this has been done successfully and why service providers are really the focus here. And then diving into unconscious bias. So in this module, we talk a lot about implicit bias or unconscious bias, which comes into play in the service delivery context quite a lot. Then under steady, which is the how-to, we talk about planning and designing programs. So in this portion, we try to go through the project cycle or the programming cycle a little bit. So planning and designing a program, then actually sort of carrying it out. How do you identify bias? And then how do you address bias and ableist frameworks and mindsets in a service delivery context? How do you address unconscious bias through participatory approaches? So everything from a community dialogue to participatory research. And how do we promote self-efficacy, which has been proven to be a really strong pathway toward more inclusive services, self-efficacy, both in terms of the provider and their behavior change journey, as well as the client, or in this case, the children with a disability. And then under set, this is again where we sort of invite you to gather inspiration and scan, I suppose, the field and sort of see what other people have done well and what's working. So we would share a whole host of case studies, best practices, and testimonials. And then under go, it would almost be a catalog for you to choose from of different tools and techniques. In this case, we might have a self-assessment checklist. We link to a provider behavior change map, as well as a guide to use the map. We have introduced a few other tools for self-assessing implicit bias and things. So that's just an example of what one of these modules might look like, the level of depth we'll go into, and the kinds of practical tools and techniques that you can expect as you read through it. One thing we're keeping in mind is that the toolkit is not, most likely, as with other toolkits, you will not be reading it from cover to cover. I'm sure you will maybe be working on disability inclusive and sensitive services one day, and then you might switch to, wanting to learn about engagement another day. And so we've designed it in that way that you can sort of navigate efficiently to whatever module is most relevant to your work. And that module can sort of be engaged with in any number of ways as well. Okay, moving right along. Next slide, please. So Nafisa, jump in if I miss anything here, but with this slide, we really wanted to introduce the stream of work that sits alongside the development of the toolkit, which is really our engagement stream. So we are really intent on having as collaborative of a process as possible. We build off of work that UNICEF has already done. So they've done a range of consultative meetings at a global level. They've also done an evidence review, as I mentioned earlier, to identify certain gaps to really kind of trigger the development of this toolkit. And there have been, there's been other meetings as well, which really kind of informed our engagement plan. So with our engagement plan, what we're hoping to do is establish 2 labs, we're calling them. So one is the Global Practice Lab. That's kind of the language we're using, because we do want it to feel like we're tinkering and we get to roll our sleeves up and get underneath the toolkit a little bit. It's not sort of just here it is, can you validate it? But we really want to invite you to engage with it and really help us shape the content. So the Global Practice Lab will be comprised of SBC practitioners, youth advocates, people working in disability inclusion, people from OPDs, government partners, UNICEF staff. So there's quite a range of people who have been invited into the Global Practice Lab. Some of you on this webinar have yourselves been invited. So we will engage you in a number of different activities. The first being the orientation meetings, which are actually starting next week. So really the orientation meetings they're just that. They're 1 hour, quick and brief, and we really want to kind of introduce you to where we're at with the toolkit in more detail, and introduce you to this concept of a lab and why we're doing this, and invite you into some of the other modalities we have for engagement, which, as you can see on the screen, are the in-country workshops. We will be doing at least 1, maybe 2 in-country workshops, border restrictions permitting, to gather insight and inspiration and really take a deep dive into a few of the modules that would be relevant in that country. In the programming there, we'll have regional workshops, which will be virtual workshops online with the UNICEF regional offices, and we'll have a global workshop altogether. We'll supplement this as well with some semi-structured interviews with a few key stakeholders, key informants. And again, we're supplementing it with that Google form link that we shared earlier, and we'll share it again, where we're trying to do a massive call for any resources or tools or inspiration that you can share as well. So we're really trying to remain as open as possible and source learnings and insight from all of you in a bunch of different ways. If you are interested in joining the Global Practice Lab, we certainly have some seats available. We'd love for you to be there. We'd love to have as diverse of a group as possible. Please let us know that by registering your interest, because the orientation meetings are coming up very fast. They're actually next week. We're running that orientation meeting 3 times to accommodate the different time zones. So register your interest using the Google form link that Sarah has just dropped in the chat, and let us know, and we'll be happy to introduce you by sending you those links for the orientation meetings. We can kick off that way. Nafisa, would you like to just quickly touch on the Youth Advocacy Lab?
Yes, and maybe just to also add, in terms of the Global Practice Lab, we're also hoping to get a champion, a module champion to would work more closely with us with the development of specific modules. That's someone who has really keen interest in that area or expertise in that area. So we're also hoping to have some module champions on within the Global Practice Lab. So in terms of the Youth Advocacy Lab, so we really, really want to hear the voices of young people, because they have great ideas to share, and also their lived experience is so important. But what we really want to focus on again is solutions. What has worked for them during their lifespan around developing their leadership, self-efficacy, etc., and help. And for that reason, we're having 2 youth advocacy labs. One will be online at 2 phases of the development of the toolkit, which Carly will guide us through next. And then in the in-country workshops, we'll also be gathering some stories and video footage. And we also hope to get them more engaged in the social media, and dissemination of the toolkit thereafter. Thanks. Over to you, Carly.
Yeah, great. So again, if you're interested, please register your interest in that Google form link. And then if you have any case studies, testimonials, best practices, learnings, stories, anecdotes, quotes, imagery, anything that you would like to share with us for inclusion in the toolkit, we are all ears and eyes, and we are happy to take that into account. And you can use the link in the chat. Next slide, Sam. Are we ready for Q&A? I think that's next. Yeah, so I think we'll stop there. Nafisa, is there anything we've missed, or should we open up the floor?
I think we can go through the Q&A, and I'm sure things will come and arise from that discussion.
Good. All right. Well, we've got plenty of time. So Sarah's moderating the Q&A, I think. So yeah, let us know your thoughts.
Maybe just to add, the main target audience for this toolkit will be UNICEF staff. And I think that's really great that it will be, because they have such a massive impact on the sector that involves supporting children in some of the most complex regions. So I think that that's really great, that all UNICEF programming will look at eliminating stigma and discrimination, which is also one of the Global Disability Summit commitment. But of course, the tools that we are creating can also be used for NGOs and others in the sector. So I see a question. What is the roles of religious norms in stigmatization and discrimination? And do you see a role of religious actors in SBC? That's a really great question. Would you like to take that, Carly, and I can come in as well?
Yeah, I'd be happy to. It's a big question. It's a great question. There's probably no one answer to it. I can speak from our experience at ThinkPlace, which is that, again, primarily in health contexts, with things like modern contraceptive, family planning, birth spacing, safe medical abortion, post-abortion care, religious norms absolutely come into play. Even female genital mutilation, which is a project we're working on now, and a few other spaces, we've definitely seen this come to light, particularly in fairly communalist societies, collectivist societies, and particularly in more socially conservative cultures. We do see religious norms coming into play a lot. They're often self-reported as the reason why, as the primary reason why something is done or not done. Although in our experience, if you can get underneath that, you do see a lot more nuance. So I think people have what's called a social desirability bias. They know what they should be saying, especially when a researcher is in front of them, or their peer is sitting next to them, or their mother can overhear the interview or whatever it might be. They might be biased to say that they're compliant with a religious norm. But in our experience, there's a lot more nuance that sits underneath that. So for example, we did research in northern Nigeria, which is quite a conservative part of Nigeria, and religious norms were definitely, quoted as the reason why certain things would happen. And then we saw, and this had to do with women feeling empowered in their health journey, and that empowerment coming primarily from their spouse. And yet we saw a lot of people who are non-compliant with some of those norms and having extramarital affairs or even homosexual relationships and all of these sorts of things. And again, you know, looking at the problem a little bit more holistically helps, right? I think if you have a singular line of questioning and you're sticking to that, you never sort of get the full story. So that comes with kind of finding new ways to ask the same question. And it also comes through repeated intervention and that continuously spending time with people and building trust with people, and repeatedly, like I said, intervening or finding new ways to ask the same question. We found that to be the most useful way. Sorry, that's not an example that relates to what we've spoken about in this toolkit, but yeah, I could go on and on about that.
And I think what it really brings to forward that we need to focus and maybe have a bit of a section or touch on the topic of how to potentially reach out to religious actors in communities. And I know that lots of our programs, like for the World Community-Based Rehabilitation Workers or Disability Inclusion and Community Development Workers, they do have some awareness raising on sessions with religious leaders. It might be a one-dose kind of situation where they just go have one conversation. But like Carly says, sometimes it's really important to ask the same question in different ways and have multiple interventions with religious actors that might be a bit more effective. We might learn from other sectors to take that approach. And I think it's important that we do know in the communities that we work in that is an important target that we should talk about or address in our toolkit. So thank you for raising that question.
Can I just say one thing
Anna?
and then can I just jump in with one thing and then Anna, I see your hands raised and then there's a few really interesting comments in the chat as well. Yeah, I was going to say to reinforce your point, Nafisa, which is absolutely right. I think again in our experience, religious leaders can be really powerful in sort of top-down communication or social behavior change messaging. So that can be a great intervention point. They're great at sort of signaling what is the new norm or the desired behavior. So if there is pervasive stigma and discrimination against a particular group, then they can be a really, really important intervention point for us. The other thing to say is that again, with thinking about social behavior change, so much of that is about communication, and religious leaders tend to be quite, and sort of faith-based organizations more broadly tend to be quite good at sort of collective communication. So sort of, we are about this, we are for this, this is what we are against, and this is what we're for, and really making that clear for people. And we've seen the communities that we work with, if you can sort of use that tone and that style of messaging, it's extremely effective, in contrast to so many different places. Like I currently sit in Australia, that kind of messaging isn't always as effective, but in some of the communities I can think of that Think Place has worked in recently, that's certainly been extremely effective. Anna, over to you. Sorry, I know you have a burning comment.
No, perfect. Thank you, colleagues. Thank you for the good conversation and the questions. Just to add from disability perspective, so I work for disability section of UNICEF and in touch with organizations with disabilities and people with disabilities themselves. So there's also different models, right, on disability, and one of the models is actually charity model, and it's still present in some countries, specifically in East Asia Pacific and Middle East, unfortunately, where people with disabilities are seen as a curse or as a blessing. So this is also very much linked to the question. While in this toolkit, our main approach is definitely human rights model, not the medical, but really human rights model, not the charity. So definitely this religious leaders and faith-based organization play quite an important role, and it is not an easy topic indeed, because of this model is actually really incremented in the society already. So thank you.
Thanks, Anna. It's very true. We don't want to encourage inclusion coming from a charity of thinking, right? Yeah. Is there any more questions? Are there any more questions on the chat that we could address?
I think Maria's raised her hand.
Maria, over to you.
Hi, I'm Maria. I work at London School of Hygiene and Tropical Medicine. I was just going to say that I noticed we've developed a module on stigma, which we've called Togetherness and Belonging, and I put it in your link. But one of the issues that interests me, I noticed you use the word families, and I think it's worth breaking down families because actually most caregivers are women, and many families in sub-Saharan Africa with a child with a disability will be female-headed and will be single-parent households often. And there's a lot of issues around stigma there for the child and also for the mother, with blame on the mother for having a child with a disability, which is often why the husband's left in the first place. So I just think when I've reviewed the data, we talk about families, but there's a lot of issues there around female caregivers. And if we're taking a gender perspective, I think that would be really helpful to reflect on in the toolkit.
Yeah, I think I wonder if that's something, Nafisa, we can think about in sort of the introduction, but also in the relevant units across the modules to clarify what we mean by that. I think there's a whole piece we're going to do around definitions and breaking that down a little bit.
I just muted myself. But I think what also Maria brings into, sort of alerts us to, is that there's often the multiple stigma being a single mom also, what that also entails, right? Often mothers are single mothers, and that means that they, in some, I've noticed in health settings, they won't get helped first unless they have their, if a woman goes with her partner to a health center, they often get preference, or they are, so they get preference that we've noticed in some programs, what I've observed. So there are lots of other stigma and discrimination that come into play when you are a woman alone taking care of your child with a disability. So it's important that we really address that, and in what place in the social strata just a woman, a single mom also has, and emphasize the multiple discrimination that people experience, right, because of their gender. But I like the thing about family parts also, that we have the family aspect, and there are also, I think we should also be aware that often men with disabilities I know of who actually also are single dads, and I think that we should always, yes, the majority is single women, but there are also men with disabilities who also are single parents. Are there other hands, Khali?
No, I don't see any hands up now. It looks like there were some questions further up in the chat that maybe we should address. So this might be it.
Yeah, go for it, Sarah.
Yeah.
One of the questions raised in the chat was how would we be addressing issues related to media within the toolkit?
So we actually, we will have a unit on media in the toolkit, because we feel that representation of persons with disability in media play a really big role around how they are perceived in society and the community. So So this will be an area in the toolkit that we plan to address. Right, Carly, from this, I know that also in the disability sector, we've done trainings. Many of our organizations have done trainings with media to talk about rights-based language, to explain the different models. And also, we've also looked at having more positive stories in media around people with disabilities. I don't know if Carly, you'd like to add around the media part and your experience in SBC and the role they play?
Yeah, as I said, I think a big part of SBC is communications and messaging, and the different channels that those messages come through. So yeah, absolutely. I think it won't be a dedicated module because I think it kind of weaves through a few different of the modules. So I suppose it's more of a unit, as you said, Nafisa. So yes, that will absolutely be covered in the toolkit. I should say too. Oh, sorry. Go ahead.
So I should say, if there are any great examples, we found online already some examples of media training, but if you've had any great experiences to share, we'd really welcome you adding that to the chat or put in or contacting us so that we can include that in the toolkit, your either your resources that you developed or a good case study. Thanks. Sarah? Are there any questions, Sarah?
So I just put into the toolkit, into the chat, the module focus areas, if anybody had a specific question around any of those particular focus areas.
So if you come to the Global Practice Lab orientation next week, you'll get a bit of more insight of what we were thinking around, different units to put under the modules. And we'd be really happy to hear your input on that, if we're on the right track and we could do things differently. Yeah, so please also join the orientation meetings next week. Colin, were there any other questions further up that we might have missed?
I think there was a question from Leah around very early in the chat around translation in the different workshops, particularly for youth advocates, I think at CRS. So I'll just say that we have already locked in some in-country work with Mozambique. So we will be using multiple languages in that, and we have that capability between Light for the World and ThinkPlace. For the other workshops, a lot of them will be regional, so we will be taking into account language as we plan those regional workshops. So that'll sort of be a conversation as we start planning those. But the rest, yeah, it's sort of TBC at the moment. And I think we'd be interested to hear more about where your youth advocates are based and what kind of language requirements they would have. We could explore that, Leah. Maybe I'll just ask a question back to everyone, which is that what should we not do? Is there anything that we should avoid doing or not do or not include, apart from some of the obvious things? But is there any sort of must not, should not kind of things for us as we go forward in the toolkit? I guess I'm thinking about the range of tools and resources I interact with in my work, and some of them are better than others, and some of them I turn to more frequently than others. So Yeah, what comes to mind if you could give us sort of any recommendations or guidance, we'd be happy to hear that.
Hi, everyone. My name is Leah Eisenhart, and I'm a Disability Inclusion Advisor with Catholic Relief Services in the United States. I wanted to share that we've done a lot of work over the past year with caregivers of children with disability, mostly in the context of ensuring that caregivers have the skills they need to provide loving, nurturing care for children with disabilities and to promote family-based care. And what we realized was that in conducting key informant interviews and focus groups with caregivers, that their voices are often left behind. So I think the more you can pull their voices into these different working groups, the better. I know that that may be difficult to do in an online context, but as you move to those in-country or the in-country workshops, it would be fantastic to see if there could be some varied focus groups that you could do with caregivers of children with disability to hear straight from them. Thanks.
Thanks, Leah. I think that is so important. And so we'll see how we could incorporate those, and maybe we can also connect with you around the focus groups and that you've done, that Catholic Relief Services have done in their programs. Because I think that will also be useful for us moving forward to include some of that in the toolkit. For sure, the people will come to the workshop, the youth and children will be chaperoned. And if they do come with parents, we would have some discussions with them too, because they are very critical for nurturing care and developing the self-esteem of their children. Thank you.
I might just throw out one more question. Otherwise, I'm sure no one will mind if we give them the gift of time and we wrap up slightly early. But something else that comes to mind in a similar vein is if any organizations or anyone on the call would like to share or highlight a success or a challenge that they've been having in sort of inclusion-oriented SBC work or in sort of the disability inclusion space more broadly, as it relates to stigma and discrimination, we'd be happy to hear any success or challenge that you're facing that we might want to dig into further in a semi-structured interview with you. Thanks.
I guess, Anna, should we go with the gift of time? And Carly?
I think it sounds good. We also have emails from all the participants here who are registered. Thank you for all your time and contributions. And we'll be happy to share the recording of the video as well as any relevant materials, including the PowerPoint. Thank you.
Thank you, everybody. And we look forward to seeing you in the Global Practice Lab. And thanks to the 10 people who have already signed up. Carly?
Yeah, thank you all so much. I think this has been a great discussion. I'm just processing everything in the chat. Thank you all so much. Thank you to our interpreters. Thank you to Anna. Really appreciate it. And we look forward to looping back with you if you're part of the lab. And if not, we hope you'll be a user of the toolkit. Thank you all again.
Thank you all. Bye. Thank you, interpreters. Thank you, real-time captioner. Thank you for all your support. Bye-bye.